Hello and welcome. My name is Dr. Martinez. Thank you for choosing to do a rotation with us. What we're going to talk about today are some key important essentials about our rotation. The most important thing, of course, is always to be respectful, to be HIPAA compliant, and to keep the patient's interest in mind, not only for this rotation, but for the rest of your professional careers. I'd like to mention 5 main points that we need to do here at CCS. Every clinic is a little bit different, and so we need to keep in mind these very important features if we're going to do things successfully. The first thing is really to just fill out. If you see a blank, it needs to be filled in, even if it's NA or not applicable. So if you see allergies, fill something out. Make sure that you don't just fudge it or make something up, but get the information and help us in better assessing the individual. The first point is the psychiatric evaluation. So the psychiatric evaluation, if a person's coming in for the first time, needs to read psychiatric eval. Keep that in mind. Don't fill out the progress note. This is psychiatric eval. Psychiatric eval requires information. It'll be much more than what you have time for. The most important thing here is keeping the vital signs so that when we get into writing out the information, that we have the correct documents. For the psychiatric eval, probably something very easy that you can do is the age, the sex, the marital status, where the person lives, with whom the person lives, and whether they're going to school or working. You can identify that kind of information. If you have some more time, then we can go ahead and certainly do the chief complaint. The next step is reviewing the psychiatric eval. When you see blanks, fill them in. Put in the date, put in the name of the person, and then leave the rest for the doctor. The progress report is or progress note is probably the most important document that you'll be interacting with on a day-to-day basis. The first thing is asking, do the vital signs first and foremost. Blood pressure, pulse, height, weight, BMI. Very important for every single individual, and there's a space there for each one. If you have more time, then you want to start assessing the general medical notes right there. And what that means is, when was the last documented session with a primary care doctor? We always interact with primary care and other specialties, and we want to make sure that we're collaborating, coordinating, and exchanging information so that we collaborate in the patient care. The next point is the labs. When were the last labs that are documented in our chart? If it's been over a year for either the labs or the physical, we need to get consents and redo them again or obtain them from wherever they're at. AIMS test, abnormal involuntary movement scale, and needs to be done every 3 months for individuals on antipsychotics. Labs and physicals should really be documented in the chart once a year. Polypharmacy, more than 2 medicines or more than 1 medicine of the same class is considered polypharmacy. It's okay to be done. You have an unrestricted license to practice medicine. The important thing is to justify. We need to justify absolutely everything that we're doing. You want to write the list of the medications. Don't just write simvastatin. You need to put simvastatin, the amount of the dosage, and then the quantity, and then the prescription. The fifth and final note is the authorization for the use or for referral of information. So the release of information is really important. Fill everything out. Read this carefully a couple of times so that you familiarize yourself with this documentation very well. We need to be HIPAA compliant. We need to always ask for permission from everybody. For those individuals under the age of 12, try to get the signature of the individual plus the signature of the legal guardian, so the parents. For those over the age of 18, just themselves is enough. Over the age of 18, I need your permission to get in touch with your parents. So we need all this consent done on every individual. And then fill absolutely everything out, including the initials for the type of information we're going to release or exchange or obtain from another facility. All right, signatures go over here. Take care, thank you, and good luck.